Well, hello, I'm Bridget Fletcher, I'm Chief Executive here. Over the past few weeks I've been doing some talks to staff really about where we are on our journey as an organisation, so what's gone well so far, how things are at the present, and then actually what the challenges are that we're facing in the future. Well, I think the thing I'm most proud of is our Cqc inspection that we had last September. The report that they came back with was that there was nothing that we must do to improve. A few little things to improve which we knew about already, but actually that was a fantastic result for the organisation. And I'm immensely proud of the people who work here. And it's not just about the clinical staff, it's about all the staff, it's about everyone who works here. All of the hard work over the last few years has culminated in that really fantastic result for us. Ward 4 is a dementia-friendly ward, fantastic. The way that the estate and the environment has been really changed to make sure that where patients are cared for when they've got dementia is much more homely and much more calm for them. So there's things like signage on the doors that's a picture of a toilet rather than a sign saying toilet. There's a cafe that's going to be developed, a reminiscent type of approach, so that patients can go in there and it'll be a much more friendly environment. Endoscopy unit, a really important unit for us. Recently refurbished. It's been designed by the staff with patient input into it, so really improved the kind of care we can give to patients who come in for endoscopy. So the kind of things that are in there are separating out the male and female, changing facilities, a lovely environment, really bright, really nice colours, pictures on the walls. We've got the 3 suites now instead of the 2, so we can expand the service that we give to the local population, and it's forever growing. There's lots more patients coming in, particularly with bowel screening programmes, things like that. Ward 18, our orthopaedic ward, that's a newly designed ward, designed with patients and with staff to make it a really holistic environment for patients undergoing orthopaedic surgery. Linked to it is a really great development called the Enhanced Recovery Programme. That means when they come into the hospital setting, actually they're only in for a much shorter length of time. Patients like that. It means that we're being really efficient in our use of beds as well, and we can treat many more patients if we get our length of stay down. We've got a great new maternity unit designed by the staff with patients, with people who've had their babies here. There's new suites there that are decorated. They look like 5-star hotel rooms actually. Fantastic decor. Even got an outside space, so if mothers want to go outside and get some fresh air in privacy as well. It's their own little enclosed space. They've got that opportunity as well. Lots of space as well for the partners to be with them, and new equipment, so birthing pools. We've got birthing chairs and other equipment that is really helpful to ensure that the birth is as smooth as possible and in a way that's right for the mother. So the future holds some really major challenges for all of the NHS, and our bit of it is just as challenging as everyone else's. So we've got demographics, many more people are becoming older, and that has diseases of old age, related to it. We've got ever increasing urgent care demand, and then we've got the financial challenge. So there's a huge challenge across the whole health economy. 30 billion out, for the NHS, and when we look at our own patch, for us, that's a 12 million challenge over the next 2 years. So, we're not going to do that just by, cutting little bits of paper clips, as it were. We need to do something fundamentally different. So what do we need to do? We need to think about, the kind of care that we deliver and how we deliver it. And, the whole push from patients is that they want to be cared for at home in more homely environments. So, part of our vision for the future, our future state, is that we need to work together with partners to ensure we keep patients at home for as long as possible and as safely as possible. We've got a lot of expertise now in using telemedicine. In essence, that's video conferencing between here, Airedale, and patient-owned homes and nursing homes. Demonstrated huge changes in patient flow, so 69% reduction in A&E admissions, 45% reduction in admissions into wards, and a 30% reduction in length of stay. So, we need to think about that and build on how we can build on that further to actually get those efficiencies and much better patient care. We've got a new emergency department being built. That's going to be up and running by November this year, actually. So what that's going to help us do is really improve the way that we provide care for patients who are admitted via that urgent care pathway. It's going to link very closely to our medical assessment area, and there we've got acute physicians who take phone calls from GPs, and this is all about trying to get rid of that false divide between primary and secondary care, having a different environment for staff to work within. Turning vision into reality is the next thing for us to do, and it has to come under this right care vision. 3 big work streams that we're looking at in terms of clinical services. First one being theatre utilisation, making that as efficient as it can be, but also more patient focused. Patients want treatment in the theatre over the weekend, for example. Other areas we're looking at is patient flow end to end, from admission right through to discharge and beyond, working much more focused on the patient, getting them home as quickly as possible, caring for them in their own homely environment. Third one is looking at outpatients, and I mean outpatients across the whole spectrum, not just general outpatients, doing that differently, more focus on the patient. Don't bring patients into hospital unless they need to be seen. All of our staff are going to have to think about how we work differently with digital technology. And then, of course, there's our, what we call the back office functions, things like finance, HR, more patient focused, more focused on the staff, more focused on enabling this right care vision to become a reality. It's really important that staff get engaged in this whole programme. We can't do any of this without everyone being engaged in it, and I'm really wanting to hear what staff have got to say about this programme, bringing forward their ideas, what they can do, talking to the line manager, sending me an email about their ideas. We want to collate those into further work that we need to do, because everyone needs to have a part to play in this, and we need everyone's ideas coming forward. So, please join in. I think the values that come from being a nurse, being in clinical practice, I was a ward sister for 12 years, a long time, and I think that has given me great grounding. So actually, as a chief exec, I can understand about those strategic decisions and what impact they will directly have on staff and patients on the front line. So I think that gives me probably a different aspect than somebody who hasn't got a clinical background being a chief exec. And I think, my passion is patient and patient care, and that's what drives me. That's what I'm up here for. It's going to be a challenging future, but we've done some great stuff, up to now. We can rise to this challenge, and we can do it for our patients.